This is an assessment on the hair, skin, nails, head, neck, and lymph nodes. So I'm Ashley. I'm going to be your nurse doing your assessment today. I'd like to start off by asking you if you have any family history of any skin diseases such as eczema or psoriasis,
No.
allergies or diabetes, or do you notice any changes in your skin such as rashes, lumps, or itching?
No.
Okay, so I'm going to start with your hair on your head, and I'm just going to start touching you. And the hair is thick, clean, soft, and evenly distributed. The eyebrows are symmetrical, and the facial hair is nice and full and clean. There are no hair loss noted, no flaking, lesions, or infestations noted. The hair on the upper extremities are symmetrical, and the hair on the lower extremities are symmetrical. There's also hair noted on the digits. I'm going to now also assess your head presentation. So the head is upright and normocephalic. There are no deformities, depressions, lumps, or does it feel tender if I'm touching?
No.
I'm gonna palpate your temporal arteries. Okay, those are palpable. And I'm going to note that the face is symmetrical. Could you smile for me? The nasolabial folds are symmetrical as well. There is no tremors, edema, or masses noted. And the patient has denied tenderness upon palpation of the skull in the face. I am going to feel your mandibular joint, and could you open and close and move side to side and protrude your chin and retract back in. And I don't feel any popping or clicking. I am now going to move down the neck where we'll be assessing the trachea as well as the thyroid. So could you lift your chin up? I am just palpating the trachea, which is midline to the neck. There are no masses noted. Was that tender at all when I palpated? So no tenderness or deviation noted. I am now going to feel for the carotid artery. And that is palpable. And could you just lift your chin up, and could you swallow? Okay, and I note that the trachea, you notice movement in the trachea with swallowing. I'm now going to palpate the space between the thyroid and the sternocleidomastoid muscle, which is symmetrical. No masses, tenderness, or deviation noted there. Patient also has full range of motion in the neck. I will now assess the nails. And the nails are well clean and trimmed with a smooth and firm texture. There is instant capillary refill, and they're pink in color. The nail plates are smooth, no signs of Bow's lines. Could you put your thumbs like this? And there is a diamond shape with both the thumbs indicating a 160-degree angle with the nail bed and fold. That is a negative Shameth sign. There is no signs of infection, redness, inflammation, or tenderness. Do you feel any tenderness there? No. Which indicates parenchyma. There are also no white spots noted, which would indicate leukonchia. and that could be caused from trauma to the nail bed. There are no pitting or depressions of the nail plate noted. I am now going to note this skin overall. The skin is warm, dry, and intact, and normal in color for race and ethnicity. There is, I'm just gonna pinch on your collarbone here, and there is instant recoil there. The extremities are warm, intact, and dry. And I'm just going to check your legs here. And there is no pitting edema noted in the lower extremities. I will note that the patient has a said mole located on the back, and the mole is symmetrical. B, borders are round. C, it is brown in color. The diameter is 2 millimeters. There's no changes in the shape or color, and the mole is elevated. F, it is firm upon palpation, and G, no growth has noted. I will also note that if the patient was diabetic, you will always check the feet for wounds. And if the patient was chair or bed bound, you would, and with limited mobility, you would use the Braden scale to confirm the risk for skin breakdown. I would assess the skin on the patient's sacrum, buttock, greater trochanters, knees, and heels. And I would also assess the skin folds for any macerations, typically seen in a bariatric or elderly patient. Do you happen to have a history of headaches?
Yes.
Okay. So the patient has stated that they have a history of headaches, so I will make that noted. I am now going to palpate your lymph nodes. So I'm going to start with the pre-auricular, which is right here in front of the tragus. There is non-palpable lymph nodes here. I am then going to go to the post-auricular and palpate behind the ear, and there is no palpable lymph nodes there. I will feel in the back for the occipital, and there is no lymph nodes palpable there. Do you feel any tenderness?
No.
I will feel for the tonsillar, and then move on to the submandibular, submental, and the supraclavicular, and the submandibular and submental. Okay, no, those are non-palpable. I will then feel, could you look to the right, please? I will feel here for the supraclavicular lymph node, and there's nothing palpated that is non-palpable. And the infraclavicular. And then could you turn your face to the left? And I am going to palpate the subclavicular and the infraclavicular. I am now going to feel in the axillary, and there is non-palpable lymph nodes here, and there is also an inguinal, a pectoral, and a horizontal and vertical inguinal lymph nodes that I would palpate for here. And that concludes our hair, skin, nails, head, neck, and lymph assessment.